This video is designed to help you as you prepare for surgery and as you adjust to a new routine after your procedure. It's very important for you to watch, and along with your Guide to Surgery book, it's a critical tool that will affect the outcome of your surgery. A nurse will also be on hand after you view this video to answer questions you may have.
Let's start by telling you a few things to prepare you for your surgery. First, stop certain medications 1 week before your procedure. These medications include aspirin and anticoagulants or blood thinners like Coumadin and Plavix, and herbal products like fish oil and omega-3. No heart medications aside from diuretics and certain anti-hypertension medications should be taken on the day of surgery.
You should stop all of your oral diabetes medications 24 hours before surgery. Don't take any of your short-acting insulin on the day your bowel prep is started. And the recommendations for the use of your long-acting insulin, that'll be discussed at your pre-op visit.
Please check with your doctor regarding other medications to be avoided before surgery.
All other prescribed medications should be continued up to and including the morning of surgery with a sip of water. Specific medications that you should not take on the day of surgery will be discussed at your pre-op visit.
Beginning the morning 2 days before your surgery, you need to go on a clear liquid diet. So, if your surgery is scheduled for Wednesday, you need to begin that clear liquid diet on Monday morning. By clear liquids, we mean anything you can see through: water, broth, white juices, and other liquids with no sugar added. And remember, nothing that's colored red.
The same day you begin your liquid diet, you will need to take the bowel prep prescribed by your physician. Prepare it as instructed on the package. Then pour 1 cup, 8 ounces, into a glass and drink it. Drink 1 glass every 10 minutes until you've had 4 glasses in total. You can throw the rest away. Continue with your clear liquid diet until midnight the day before your surgery. You will also need to call your physician's office to speak to the surgery scheduler to confirm your arrival time.
If you haven't already, please make a checklist of the things to bring with you to the hospital. This includes comfortable clothing, dentures, and glasses. If you wear contact, please feel free to bring them. You will also want to bring some reading material and something to keep you busy while you wait for your procedure and during your hospital stay. You won't want to bring any medication, and you should leave all jewelry and other valuables at home.
The night before your surgery, take a shower or bath using Hibiclens. That's a special surgical wash. You can put on a small amount of deodorant afterwards, but don't wear any perfumes, makeup, powders, lotions, and it's important that you don't wear nail polish. Do a second shower with Hibiclens the morning of your procedure and concentrate on your abdomen. Again, no lotions or powders. The day of surgery, you can take your prescription medications with a small sip of water. This includes your medications for heart, asthma, anti-seizure, cholesterol, psychiatrics, and narcotics for pain. Your specific list should be reviewed with the nurse. Let's review. 2 days before, clear liquid diet and bowel prep. 1 day before, call for arrival time. The night before, shower with Hibiclens. And after midnight, nothing to eat or drink.
When you arrive at the Cleveland Clinic main campus, come to P20, the Cleveland Clinic Surgical Center at the corner of Carnegie Avenue and 90th Street. The most convenient parking lot is Garage 4. Bring your parking ticket in for validation. When you're brought in for surgery, we will give your family members a blue pager to notify them of any surgical updates.
While you are in the hospital, we will encourage you to begin walking. Walking is very important because it encourages the blood to flow, which speeds your healing process and will help prevent blood clots. You'll also be given one of these, an incentive spirometer. You'll need to use this 10 times an hour to help you keep your lungs clear. You inhale deeply until the ball reaches the middle of the smiley face, hold it, and exhale. Please make sure to do this 10 times an hour. You're also going to be given this to take home, and we encourage you to use it for the first few weeks after surgery.
Many patients ask about pain and what to expect. We'll give you a pain ball that works automatically and a pain button that allows you to manage your pain. If you feel pain, press the button. You can expect some soreness, But if you're ever feeling more pain than you can control, let one of the nurses know. It's important to stay ahead of your pain, as this can help you recover faster. To prepare for your transition home, you'll receive prescriptions for any of the medications you'll need.
Finally, during your entire hospital stay, you will be encouraged to wear inflatable stockings. This will promote blood flow and help prevent blood clots. When you leave the hospital, you'll be given prescriptions and pain medications as prescribed by your doctor. These may include ursodiol or Actigol to prevent gallstones, Pepcid to prevent ulcers, Lovenox injections to prevent blood clots, and pain medications as prescribed by your doctor.
There are pharmacies here at Main Campus where you may have these prescriptions filled, and of course, you can also use your own neighborhood pharmacy.
There are additional things to keep in mind. If you have sleep apnea and have a CPAP machine, bring your mask with you to the hospital. You will be evaluated by a respiratory therapist, even if you have not been diagnosed with sleep apnea and are currently not using a CPAP machine. It's possible a drain will be inserted in one of your incisions during surgery. This may or may not be removed prior to going home.
While you are in the hospital, you will receive twice daily injections of Lovenox that will help prevent blood clots. Some patients may continue the injections at home for 2 to 4 weeks. An instruction video will be provided. And just to recap, get up and walk, drink water, breathe using an incentive spirometer at least 10 times an hour, and your pain will be managed with a pain ball and a pain button.
At home, you do want to look at all of your incision sites. Keep them clean and dry, and use a dressing if there's any drainage. Some reddish drainage is normal, but if it's ever green or yellow, please call your physician, because this could be a sign of an infection. When you leave the hospital, you're going to be given a prescription for pain medications. If you don't wish to use this prescription, you can take Tylenol instead. Never take any anti-inflammatories, like ibuprofen or Motrin or Aleve. A few other do's and don'ts for your at-home care. Do keep moving with regular walks and stretching. This will help with your pain, with your overall recovery, and with preventing blood clots. In fact, you don't ever want to sit idle, especially for more than an hour. This goes for even if you are riding in the car. If you're going to be in the car for a prolonged time, please stop to walk at least 5 to 10 minutes every hour. This should be done for at least 6 months after your surgery.
You can begin or resume regular aerobic activity once you're discharged. It's perfectly safe for you to get on your treadmill, stationary bike, elliptical, the things that make you sweat and get the blood pumping. We just don't want you doing any heavy lifting for the first month. Do drink plenty of fluids and drink them slowly. 64 ounces a day is what's expected, so about a cup an hour. The most common cause for readmission after surgery is dehydration, so sipping the required amount of water is the key to healing.
Don't take baths or use a swimming pool or a hot tub for at least 2 weeks after surgery. Regular showers are fine. Do take a stool softener if you're prone to constipation. Do call us at any time if you're running a fever over 101 degrees or you have persistent abdominal pain that is not relieved with medication or movement. And to recap, keep moving, drink lots of water, and call if you have a fever higher than 101.
Nutrition is so important, and I want to tell you a few ways we're going to help you develop appropriate eating habits. Getting the right amount of fluids is vital, and we want you to drink at least 64 ounces of liquids a day. While you're inpatient, they're going to give you this water bottle. If you drink 3 of these per day, you will achieve your 64 ounces needed. Keep this water bottle with you at all times and sip, sip, sip 1 cup of liquid every hour. Remember to drink caffeine-free, non-carbonated, calorie-free beverages. Never gulp and don't use a straw.
In terms of advancing your diet after surgery, it'll be a very gradual process depending on how you feel. There's 5 phases that you need to go through. The times listed here are really a rough estimate, and you want your body to tell you when to progress your diet. So just do that when you feel ready.
Again, you want to drink these liquids slowly. At each meal, sip 1/4 cup or 2 ounces of a liquid protein source over 30 minutes. You do not have to drink it all, and stop when you feel full. This advice applies to all of the phases of the plan, so you always start with protein food first. You always want to eat very slowly, and when you reintroduce solid foods, they should be chewed thoroughly to prevent any blockage. Stop eating as soon as you feel full and avoid all high-calorie foods, beverages, and snacks.
Taking vitamins is also going to help your body recover very quickly from surgery. You want to get and stay healthy. So once your doctor gives you the okay, you have to take the multivitamins at least once a day, preferably with breakfast. There will be other vitamins and mineral supplements that are necessary. Refer to the handout that you received for more information. All of the nutritional guidelines are covered very, very extensively in the Your Guide to Surgery book. So to recap what we've already learned, when it comes to fluids, make sure you drink 64 ounces of what I refer to as the 3 C's. No carbonation, no caffeine, and no calorie beverages. Make sure that you're not eating high-calorie foods, foods particularly high in fat and sugar. When you get home, make sure you start advancing your diet with the full liquid diet. That's phase 2. And make sure you take a multivitamin every day.
Here in our bariatric program, we're interested in the whole person, and your follow-up with psychology and other services, along with a well-performed operation, will play a big role in your success. Now, it's normal to have a period of psychological adjustment after surgery, not just the physical adjustment. And many people will experience the post-surgery blues a few days after surgery. However, if you find that these feelings are getting worse over time or more intense, it's important that you let your psychologist here know, or your mental health care provider. Lots of people feel frustrated and impatient during those first few weeks after surgery. Getting support from other people, from our program, and remembering that this is temporary can be very helpful. If you do take psychiatric medications, you'll want to get back on them as soon as possible after surgery. At times, these medications may be less effective due to changes in how you absorb or metabolize these drugs after surgery. So if you have any concerns about your psychiatric medications, you should call the doctor prescribing them.
You will need a support person, either a family member or friend, to take you to and from the hospital. It is a good idea to have someone at home with you for the first couple of days.
When you talk with your nurse before surgery, please be sure to ask them any additional questions you may have, or to clarify any information you heard in this video. We know that working with our patients leads to the best results, and it's our hope that this video has helped you feel even more confident about what's ahead.